Good afternoon, folks. Now, take 2 on discussion B. This afternoon's topic B is substance use among older adults. Is a growing, often overlooked public health issue. Okay? So that is what we're discussing for discussion B. Let's go. Substance use among older adults is a growing, often overlooked public health issue. Recent national estimates show that nearly 1 million adults aged 65 and older are living with a substance use disorder, or SUD. This rise isn't simply a continuation of earlier life patterns. It reflects a complex mix of aging, psychology, chronic illness, medication burden, and the emotional landscape of later life. Older adults metabolize substances more slowly, experience stronger effects at lower doses, and are more likely to be taking multiple prescription medications that can interact in dangerous ways. If you or someone you know is concerned about substance use, a primary care clinician is the best first step. And the SAMASH treatment locator, or the number is 1-800-662-HELP, can offer immediate guidance. Key facts at a glance. Scope: roughly 1 million U.S. adults age 65 plus meet criteria for a substance use disorder. Trend: treatment administration. Treatment admissions for older adults more than doubled. Rising from 3.4% to 7% between 2000 and 2012. Why the risk increases with age. Slower metabolism, heightened brain sensitivity, multiple prescriptions, polypharmacy, chronic pain, grief and loneliness, and loss of independence, social isolation, which can mask or worsen substance use. These factors create a perfect storm. Even small amounts of alcohol, sedatives, or pain medications can have outsized effects. How substance use affects older adults differently. Psychologically, as the body ages, liver and kidney function naturally decline. This means substances whether alcohol, opioids, benzodiazepines, or cannabis, stay in the system longer, leading to leading to a stronger leading to stronger effects and higher risks of overdose or falls. Medication interactions. In older adults, often take 5 to 10 medications daily, sometimes more, alcohol or sedatives layered on top of opioids, sleep aids, antidepressants, or anti-anxiety medications can cause dangerous sedation, breathing suppression, confusion, heart rhythm changes, cognitive functional impacts, substance use disorder, or substance use can mimic or worsen dementia symptoms, memory lapses, disorientation, poor judgment, increased fall risk. It can also accelerate cognitive decline, making early recognition essential. Common signs of problematic use in older adults. These signs often get mistaken for just aging, which delays help. New or worsening confusion, memory issues or falls, sedation, dizziness or unsteady gait, neglected hygiene, missed appointments, or unpaid bills. Social withdrawal or irritability, visiting multiple prescribers or requesting early refills, empty bottles, missing pills, or unexplained financial strain. Screening and diagnosis and treatment. Screening. Primary care clinicians should routinely ask older adults about alcohol use, prescription medication patterns, over-the-counter sleep aids, cannabis or CBD use, pain management strategies. Medication reviews are essential to identify interactions or duplications. Treatment. Older adults respond very well to treatment when it is tailored to their needs. Effective approaches include lower dose medications, doses for withdrawal or cravings, integrated care addressing medical, mental health, and mobility needs, counseling adapted for hearing, vision, or cognitive changes, support groups designed for older adults, family involvement when appropriate. Recovery is absolutely possible at any age. Practical steps, safety actions. Start with primary care clinician or pharmacist for a medication review and safety check. Call 911 if there are signs of overdose, severe confusion, or breathing problems. Use the SAMHSA treatment locator or call 1-800-662-HELP for immediate guidance and referrals. Identify local treatment providers. Draft a conversation script for talking with a clinician. Create a family-friendly guide for recognizing and responding to substance use in older adults. Just tell me what direction you want to take next. Okay, guys, here's the second part of B for you. The title for second part of B, older adults substance use disorders are rising. Alcohol remains the most common concern. And opioid use disorder is increasing, yet age-tailored screening, brief interventions, medication treatments, and community supports are remarkably effective. When they are adapted for the realities of late life. For residents in Pennsylvania, the most reliable starting points include your primary care clinician, the SAMHSA treatment locator, and your local area agency on aging, elder care services, all of which can help you identify programs that understand the medical, emotional, and social needs of older adults. Why this matters now. We're living through a demographic shift that is reshaping the entire landscape of aging and health. Older adults today are navigating longer lifespans, more chronic illnesses, and more complex medication regimens than any generation before them. At the same time, the baby boomer generation who have historically had higher rates of alcohol and drug use is now entering older adulthood. This convergence has created what many geriatric specialists call a silent epidemic. Of late life substance use disorders, or SUDS. What makes this especially challenging is that substances related symptoms in older adults often look like something else. A fall might be attributed to weak legs or alcohol or not alcohol medication interactions. Confusion might be labeled early dementia, not by benzodiazepine misuse. Sleep problems might lead to escalating sedative use, not a conversation about grief or loneliness. Yet here's the hopeful truth. Older adults often have the highest treatment success rates of any age. Group. When care is respectful, paced appropriately, and integrated with their medical emotional needs, they bring life experience, motivation, and resilience, qualities that make recovery not only possible but deeply meaningful. Key trends shaping late life substance use prevalence. Recent national surveys show that nearly 1 million adults age 65 live with a diagnosed SUD, and one in 11 adults over 60 meets criteria for a substance use disorder. These numbers are expected to rise sharply over the next decade. Substances of concern. Alcohol remains the most commonly misused substance among older adults. Even moderate drinking can be risky due to lower metabolism and medication interactions. Cannabis use is increasing, often for sleep or chronic pain, but older adults receive little guidance on dosing interactions or cognitive effects. Prescription medications, especially benzodiazepines and opioids, are frequently misused, sometimes intentionally, sometimes accidentally, because of long-term prescribing patterns and chronic pain. Key drivers: bereavement, loneliness, and social isolation, retirement, loss of identity, and changes in daily structure, chronic pain, arthritis, neuropathy, and mobility limitations. Polypharmacy, which increases the risk of interactions and accidental misuse. Ageism, which leads to clinicians to overlook or normalize substance use. These forces create a perfect storm where substance use can escalate quietly, often unnoticed until a crisis occurs. Practical screening and assessment tools. Early detection is one of the most powerful interventions we have. These tools are validated for older adults and can be used in primary care, senior centers, or community health settings. SAMAST or SAMAST G. Short Michigan Alcoholism Screening Test. Geriatric. Designed specifically for older adults, this tool accounts for age-related changes in metabolism, social context, and health vulnerabilities. Audit C and single item alcohol screens. Useful for identifying risky drinking patterns though clinicians must interpret results with caution because older adults experience stronger effects at lower doses. Medication reviews. A structured review by a geriatrician or pharmacist can identify dangerous interactions between alcohol, opioids, benzodiazepines, sleep medications, and chronic disease treatments. Screening is not about judgment, it's about safety, clarity, and preventing avoidable harm. Supportive interventions that work. Below is a deeper look at the most effective evidence-based approaches for older adults. Older adults thrive with slower pacing, repetition, family involvement when desired, and a focus on autonomy and dignity. Treatment must honor the whole person, their history, their losses, their strengths, and their goals. Barriers and how to dismantle them. Stigma and ageism. Many older adults believe it's too late to change, or clinicians assume substance use is normal. Substance use is a normal part of aging. Solution. normalizing screening at every annual visit and frame conversations around safety and well-being, workforce, and access gaps. Few treatment programs are designed for older adults in mind. Solution: use telehealth, community health workers, and Samesha ACL tools to find age-friendly providers. Policy, pharmacy, and medical complexity. Interactions between alcohol, opioids, benzodiazepines, and chronic disease medications can be deadly. Solution: conduct a full medication review with a geriatrician or pharmacist. Cognitive impairment. Substance use can worsen memory loss, and dementia can complicate treatments. Actionable steps. Ask your primary care provider to administer the SMSG or audit C at your next visit. If alcohol or opioid use disorder is suspected, request an evaluation for MOD. With careful geriatric dosing. Use the Samasha treatment locator and Crawford County area aging to identify local programs, caregiver support, and transportation options. Consider telehealth counseling if mobility or transportation is a barrier. Okay, guys, that is your B for today. I will be back on with C after dinner. So for now, Gator Wellness, take care, folks.